Ever wondered why we vomit? It is an intriguing question that might have crossed our minds, especially during bouts of sickness. The answer lies deep within the intricate workings of our complex bodies. This phenomenon, though unpleasant, is a vital bodily function that serves as a natural defense mechanism. It is the body's way of responding to an invader, an unwelcome entity, or a harmful substance that has entered our system. Consider a scenario where you consume a spoiled food unknowingly. The sensory receptors in your body alert your brain about the potential danger. As a result, your brain sends a set of instructions to your digestive system, triggering a series of responses that culminate in what we commonly refer to as vomiting. But what exactly does this process involve? What sets off this chain of events in our bodies? This mechanism is orchestrated by a set of neurotransmitters in the brain, the area postrema and the nucleus tractus solitarius. When these neurotransmitters sense the presence of toxins, they send signals to the muscles in your digestive tract, prompting them to contract and expel the unwanted elements from the body. When harmful elements enter our body, it's the stomach's role to sound alarm. It's like the sentinel of our digestive system, steadfast and vigilant. The stomach has a lining of cells that are equipped with a truly remarkable capability: the ability to detect harmful substances. These cells act as the stomach's very own security system, always on the lookout for any sign of trouble. But how does the stomach do this? It all comes down to the stomach's lining of cells that are specialized in detecting harmful substances. These cells, called gastric mucosa, have receptors that identify potential threats like toxins or pathogens. Upon detection, they spring into action, swiftly sending a signal to the brain's vomiting center. Located within the medulla oblongata, a structure nestled deep within the brain, the vomiting center is like the command center for this defense mechanism. It's here where the crucial decision to vomit is made. This is not a decision taken lightly, but it is a decision that can be life-saving. So what instigates this process? It's not a simple answer, as there are many possible triggers. These can include food poisoning, certain medications, pregnancy, motion sickness, or even stress. Each of these triggers can cause the stomach lining to detect a perceived threat, consequently prompting a signal to the brain. Upon receiving this signal, the brain instantly springs into action. It sends messages to various parts of our body, initiating a sequence of physiological events. The diaphragm contracts forcefully, the stomach muscles tighten in preparation, and the esophagus, which usually functions as a one-way street, changes its course dramatically. The result of this cascade of events is what we commonly refer to as vomiting. It's a physical expulsion, a purging that is not only decisive, but absolutely necessary. And thus we vomit, expelling the harmful substances from our body. Pathophysiology of vomiting. The CTZ and NTS express a variety of receptors like histamine H1, dopamine D2, serotonin, 5-HT, cholinergic M neurokinin NK1, and opioids mu. Vomiting is initiated either by activation of vomiting center or by activation of CTZ. Activation of vomiting center, it is situated in the reticular formation of medulla oblongata near the vagal nuclei. It may be activated either directly or by afferent impulses. Activation of CTZ. CTZ is located in the area postrema, which is outside the blood-brain barrier and is thus more permeable to many substances than the underlying medulla. They are stimulated by efferent impulses. It is transmitted via 5, 7, 9, 10, 12 cranial nerves to upper GT and via spinal nerves to muscles of respiration. Sequence of mechanical events of vomiting. Pre-ejection phase, during which gastric relaxation and retroperistalsis occurs. It is characterized by a feeling of nausea, excessive salivation, deep, rapid and irregular breathing. Retching phase, characterized by closure of glottis and rhythmic action of respiratory muscles. Ejection phase, during which closure of glottis continues, pyloric part of stomach contracts firmly, and its contents are transferred to flaccid body of stomach, simultaneously intense contraction of abdominal muscles and the descent of the diaphragm. From the esophagus, the contents are expelled into the mouth. Moving on to our next section, let's discuss our approach in dealing with the unpleasant symptom that is vomiting. It's well recognized that vomiting can be an indication of an unwell state, suggesting that something could be amiss within our bodies. However, there are defined measures that one can implement to ease discomfort and avert additional health problems. To begin, hydration is paramount. The act of vomiting is a process that can result in the body losing significant amounts of fluids and electrolytes, thus potentially leading to dehydration. This in itself can be responsible for triggering a series of further health concerns. Therefore, it's of utmost importance to replenish these lost fluids and electrolytes. This can be achieved by regularly sipping on clear fluids such as water, clear broths, or specially formulated rehydration solutions that are conveniently accessible at most pharmacies without requiring a prescription. Subsequently, it's worth mentioning that there exists a range of over-the-counter remedies that can aid in managing and controlling the act of vomiting. These include bismuth subsalicylate and certain types of antihistamines. However, it's crucial to bear in mind that these medications should only be used strictly as per the directions provided, and they may not be appropriate for every individual. Therefore, it's essential to read through the instructions with care and caution. Finally, and perhaps most importantly, it's necessary to be aware of when professional medical help must be sought. If the vomiting continues unabated for a period extending over 24 hours, or if it is accompanied by other severe symptoms such as the presence of blood in the vomit, intense abdominal pain, or high fever, it's time to make that all-important call to a healthcare professional. It's crucial to remember that while these tips can assist in managing symptoms, it is always best to consult a healthcare professional if symptoms persist. They possess the expertise to provide an accurate diagnosis and formulate a comprehensive treatment plan specifically tailored to your individual needs. Stay safe and remember to listen to your body. Motion sickness. Antiemetics with anticholinergic antihistaminic property are the first choice of drugs for motion sickness. Morning sickness. It's better to avoid antihistaminics as they are suspected to have teratogenic potential. Dicyclamine promethazine may be prescribed in low doses. Anticholinergics, hyoscine, mainly used for motion sickness. It acts by blocking conduction of nerve impulse by applying a transdermal patch containing 1.5 milligrams of hyoscine is to be applied for 3 days behind the pinna. Dicyclamine, this is used for both motion sickness and morning sickness. It has been cleared of teratogenic potential. Antihistaminics promethazine, diphenhydramine, dimenhydrinate. Drugs are mainly for motion sickness. They block the extrapyramidal side effects of metochromide. They produce sedation, therefore not advised to be taken during driving. Doxylamine, marketed in combination with pyridoxine. It is specifically promoted in India for morning sickness. Cinnarizine, it is an anti-vertigo drug. It acts by inhibiting influx of calcium from endolymph neuroleptics, blocks D2 receptors in the CTZ, used in post-operative nausea and vomiting, disease-induced vomiting, malignancy-associated and cancer chemotherapy, radiation sickness, vomiting. Morning sickness causes hypertension and muscle dystonia. Prokinetic drugs. These drugs promote gastrointestinal transit and speeds up gastric emptying. They also act on CNS and blocks apomorphine-induced vomiting. Metoclopramide can be taken during pregnancy. Long-term use can cause Parkinsonism, galactorrhea, and gynecomastia. Prokinetic drugs. These drugs promote gastrointestinal transit and speeds up gastric emptying. They also act on CNS and blocks apomorphine-induced vomiting. Metoclopramide can be taken during pregnancy. Long-term use can cause Parkinsonism, galactorrhea, and gynecomastia. Domperidone blocks D2 receptor antagonist mosapride carries risk of arrhythmias. 5-HT3 antagonists ondansetron blocks action of 5-HT3 receptors on vagus in CTZ and NYS, used to control cancer chemotherapy or radiotherapy-induced vomiting, also used to treat vomiting induced by other drugs. Palonosetron, longest-acting 5-HT3 blocker. NK1 receptor antagonists activates NK1 receptor in CTZ and NTS by substance P due to emetogenic chemotherapy, adjuvant antiemetics. Corticosteroids can partly alleviate nausea and vomiting. Benzodiazepines, cannabinoids, dronabinol,